Good afternoon and welcome to our daily media briefing. You know, as we've seen, there's been a lot of changes going on. Our regular lives and businesses have been upended, and over these last couple of weeks, we've all had to adjust to, a new normal. But earlier this morning, our Board of Supervisors held its regularly scheduled board meeting. That is the most visible example of the difficult times that we're having, but at the same time, it's a demonstration that our Board of Supervisors and the County of San Diego has remained open for business to provide the services to our residents that they need and rely upon. Now, we have obviously adopted some changes in the way that we deliver some of these services, but let me assure you that the dedicated county employees that we have are still on the job to make sure that you get the help that you need. Now, public safety remains our top priority, and our emergency dispatchers and first responders remain busy fielding and responding to calls. Enforcement of public health orders has been achieved largely through voluntary compliance, but our deputies have issued 40 citations for a violation of these orders. Meanwhile, our probation department is stepping up its response to state release of inmates from the state prisons. The district attorney and public defender and others in our legal system are using teleconference calls to handle cases, and residents can still get connected with our child support services case managers online, including through a live chat feature. Meanwhile, our Department of Animal Services is still rescuing animals and taking in strays. During normal times, our Health and Human Services Agency is busy helping connect people to valuable services, and now during this crisis, the agency and its contract service providers have stepped up to provide essential public health and social services, especially for children, seniors, and the homeless. They are providing help with food assistance, health insurance, and rental assistance through a mostly virtual system that includes telephonic and video calls. The agency has increased its meal delivery services to seniors and the homebound by 92%. Food stamp applications are now up by 96%, and there is a 72% increase in calls to our county access line to connect people with services. The county truly offers a vast array of services, and in addition to these, we are also continuing to respond to hazardous waste complaints, making road repairs, working to inspect and monitor restaurants to ensure food quality, lending out e-books through our county library system, and conducting marriages that were previously scheduled. And our Registrar of Voters certified the March primary election on time. My sincere gratitude goes out to all of our county employees who have been flexible and nimble in dealing with new work routines while still providing services to the people of San Diego County. For all these services and more, please visit our county website at sdcounty.ca.gov. Now today we're going to be hearing from Supervisor Fletcher, who's going to go over the numbers and some charts. He'll be followed by Dr. Wilma Wooten, our Public Health Director, who will give us the latest on the medical report. Supervisor Fletcher.
Thank you, Chair Cox, and good afternoon. It is with a heavy heart we come before you today. As you will see in the numbers that we report out, today's totals include a loss of 12 lives, our single largest loss of life, which brings our total to 31 deaths from the coronavirus outbreak. This really is a stark reminder of the challenges we face, the difficult road that lies ahead, and the importance of the actions that we take each and every day. We are fighting for every single life, and this fight will continue all the way through this crisis. But as we have said multiple times, the month of April is a key month. It is a month where we can expect the number of cases to increase, the number of hospitalizations to increase, and the unfortunate loss of life to increase as well, which is why we continue to stress to the public all of the actions that we are taking together. We know that our region is faring much better than many other areas and many other parts of the country and certainly the world. And that is because of the number of San Diegans who have committed to join with us in this effort. It is a testament to the incredible work of our public health experts and doctors, our healthcare systems, and frankly, it's a testament to each and every one of you who every single day are in this with us, and we will get through this together as a region, and we will come through. But it is a reminder of the challenges that we are going to face as we go through them together. Today at our Board of Supervisors meeting, we gave an update on a number of the actions that were taken, and I will share a few of those with you. The first was just a recap of the efforts that we talk about on a daily basis, but it is worth reinforcing, and that is the efforts around flattening the curve. Without the protective measures that are put in place, you can see in jurisdictions that have not taken early measures the serious spike in the overwhelming of the health system capacity, which are many of the images that you see in jurisdictions where the hospital systems are simply overwhelmed. With the protective measures that we've talked about, we hope to have that ability to flatten the curve and bring it down. So what should the public do? To quickly recap a number of the things, first is follow the governor's executive order to stay at home. Follow our recommendations to cover your face. Practice physical distancing, making sure you have at least 6 feet between persons who are not a part of your family unit. Continue good hand washing practices. This is vital. Even if you touch a surface that has been infected, if you don't touch your eyes, your nose, or your mouth before you wash your hands, you will be okay. If you're sick, stay home and self-isolate. If your symptoms worsen, contact your healthcare provider. And by all means, if you leave your place, cover your face. Our call to action remains the same. Stay at home. Practice social distancing. Cover your face. There continues to be community of transmission of COVID-19 in San Diego County, and we expect this to continue for the foreseeable future. And the county will continue to respond in coordination with our hospitals, cities, schools, businesses, and other regional partners every day. But a second part of flattening the curve is raising the bar, and that is that dotted green line you see right there of healthcare system capacity. And we're taking a number of proactive steps that are our current efforts around raising the bar. Just this week, we announced the Palomar Medical Center in Escondido is the recipient of the 250-bed federal medical service that we expect in the coming weeks that to be delivered and get up and operational. Our Live Well mobile office is assisting in testing to augment our testing capacity. We have an alternate care site, which we hope to open in the coming week at UCSD, which will help move folks from a hospital into a new setting, freeing up a hospital bed. And our efforts around the convention center continue to bring vulnerable populations in and have them be able to access health screenings, mental health services, and behavioral health services. So the efforts to raise the bar and flatten the curve go together with the hopes of getting us through this without overtaxing our healthcare system capacity. We also shared at our board meeting today some trends, some data, some analytics that have been put forward showing that the actions that we're taking are having an impact. A 50% reduction in retail and recreation, a 15% increase in the number of folks staying at home and residential, 64% decline in transit station, which mirrors very closely the decline in ridership, 41% drop in folks at workplace, 26% drop in grocery and pharmacy, and a 51% decrease in the number of folks in our parks. And we thank the people of San Diego for your cooperation and your efforts. And we just remind any of those individuals that are not adhering to it, now is the time to do it. The actions and the decisions we make will chart the path for the future of our region. Let's go into our daily updates. Number of new cases is 50, which brings our total to 1,454. We don't have a chart on testing today. There's a data issue we're resolving. We will bring that back tomorrow with updates. And then our next chart, our daily status report, obviously you can see the positives. We've added a category to this. You will see in the blue line there, which is estimated recovered. And it is important to note that this is an estimation. We are following the best practices for many entities around the country to essentially take 14 days after a positive test, subtract any loss of life, and post an estimated recovery. But you can see there at 201. Yesterday in our evening report on our website, we started disclosing the positive test breakdown, not only by jurisdiction, by zip code, by age, but we added race. And in the coming 24 hours or so, we will start providing the death data by similar racial demographics as well. Motel rooms, slight uptick in one, slight downtick in the other one, not a significant change there. We continue to engage our health system partners to make sure that every positive test and PUI knows that these resources are available, and I know the Regional Task Force on the Homeless is moving to not only stand up the convention center, but to make sure that these rooms are available to our unsheltered individuals who they're appropriate for. Increase in all the other categories on our outreach efforts. This is both nursing calls, 211 calls, epi calls, hygiene kits, hand washing stations, and toilets distributed remain static, and they will remain static pending any additional request. Personal protective equipment, we had an increase of over 100,000 items of personal protective equipment that have been distributed, almost 100,000 distributed in the last 24 hours. And the ventilator chart is essentially the same. It shows a little downtick, but that's because at the time of producing the report, only 22 of the 23 hospitals had reported. We will continue to keep you apprised of all developments along with the daily metrics and standards of what we're tracking and what we're seeing in the region. And with that, I would like to turn it over to Dr. Wilma Wooten for our Public Health Officer's report.
Welcome and good afternoon, everyone. Thank you to residents, businesses, governments, and organizations for helping San Diego to flatten the curve. We are asking you to stay the course, stay home, and when you leave your place, cover your face. Regarding the global, national, state, and local statistics, globally, today, there are 407,100,000 positive cases, which includes approximately 81,103 deaths. Nationwide, 386,800 positive cases have been reported. This includes 12,285 deaths. Statewide, there are 16,429 positive cases, which includes 397 deaths. Today, the County of San Diego is reporting 1,454 cases, which is 50 more cases than yesterday, and 31 deaths, which is 12 more than yesterday. Again, the increase in deaths should be no cause for alarm, as the number of deaths typically lag behind the number of positive cases reported. Of the 1,454 cases, 789 or 54% are between the ages of 20 and 49 years of age. 701 or 48% of the total cases are female, 51% or 747 are male, and today there are 7 cases for which we have no gender identified, and this represents 0.4%. Of the total number, also 289 or 19.9% of the cases have been hospitalized. 109 or approximately 7.5% of the total number of cases have been admitted to the ICU. This number also is 38% of the total number of those individuals hospitalized. Lastly, the 31 deaths represents 2.1% of the total number of cases. Most of these individuals had underlying medical conditions. 61% are male and 39% are female. And as Supervisor Fletcher noted, tomorrow we will have additional breakdown regarding race and ethnicity. Our sincerest sympathies and condolences go out to the families and friends of those individuals that we've reported who have lost their lives due to COVID-19. Regarding outbreaks in congregate and community settings, we are reporting 8 new outbreaks for a cumulative total of 25 confirmed outbreaks. There are 6 new outbreaks in a congregate facility for a total of 17 locations, representing 133 cases. And then there are 2 new community setting locations for a total of 6 locations, which represents 33 cases in the total number. Regarding our lab tests reported for April 6th through 11:59 yesterday, our public health lab conducted 30 tests and hospitals conducted 679. And we do not have the actual numbers for commercial laboratories at this time, but that information will be included on our website at the end of the day. Once more, thanks to everyone for conducting and adhering to the executive orders from the state and our local health officers' orders for the various non-pharmaceutical interventions that are helping, again, to flatten the curve to slow the spread of COVID-19. Now, COVID-19 has thrown a curveball at many activities, and particularly for this week, which is National Public Health Week, which is recognized this year from April 6th through the 12th. Typically, in recognition of this annual event, the county convenes its Public Health Champion Awards event, which was previously scheduled to be held this Friday. This year, the event will be modified and presented virtually. While everyone's mind is on COVID-19, there are still lots of ways to celebrate National Public Health Week while keeping our community safe. Beginning this Friday, we will start to announce one recipient each day until the total list is completed. To begin this week, in recognition of National Public Health Week, I would like to thank all of our hospital workers for their steadfast work that is being implemented to fight COVID-19 to keep our community healthy and safe. Now, please welcome Chairman Cox to begin our question and answer session.
Thank you, Dr. Wooten. We will now go to the phoned-in calls. I believe we have 4 waiting. If in the introduction to you, if we don't state your name and your outlet, please do so when you're called upon. Let's go to the first call.
10 News, please state your name and question.
Hi, this is Steve Atkinson with 10 News. This morning we understand that there were at least 2 people taken off the Disney Wonder cruise ship, which is currently docked at the B Street Pier and placed into 2 separate ambulances by individuals who appear to be in hazmat-type suits or at least full covering from head to toe. Can you tell us what you know about that and if the individuals were showing symptoms of coronavirus?
Dr. McDonald will answer that question.
Thank you for that question. There were 2 individuals who were medically evacuated from the Disney Wonder today with respiratory symptoms. These were individuals who were known to have COVID by testing and have been followed on the ship, and each developed signs and symptoms that needed to be taken care of at hospitals. One patient I know has been admitted. I think the other is under investigation, and that's all the information I have at this time.
I'm assuming, Dr. McDonald, that if the ship has been docked for some time, that these would be crew members. Can you confirm that?
That is correct. The Disney Wonder only has crew members aboard.
Thank you.
Okay, we'll go to the next question.
Voice of San Diego, please state your name and question.
Yes, hi, this is Will Huntsberry. So I had a 2-part question here. Supervisor Fletcher showed a chart about flattening the curve and our hospital capacity. That second curve hit right at our capacity line. Is that second curve still based on a 6-day doubling rate? That's my first part of the question. The second part is that hospital capacity line appears to be based on if all hospital beds were available. Obviously, we know that's not going to be the case. Other people are going to need to go to the hospital for different reasons. What is the hospitalization rate currently of people who do not have COVID-19? It's my understanding that hospitals are sharing this information with you on a daily basis.
Okay, Supervisor Fletcher will answer the first part of that question.
I'll take the first part, and then Rob can go to the second part of the question. The chart that we laid out some time ago was to demonstrate the difference in a 3-day doubling and a 6-day doubling. We obviously are much closer to a 6-day doubling, both in terms of cases, hospitalizations, and ICUs, somewhere between 5.2 and 5.8, depending upon which one you are looking at. But that was to demonstrate those 2. That also showed a top bar that was about the total number of hospitals. And then if you look at the chart, I know it's been a while, but if you look at it, it's at a historical average. of occupancy. And so we don't believe we're at the historical average of occupancy. We believe we're in a much better position because a lot of the actions and steps that have been taken. And so the efforts, again, are to raise the top line and the gray bar, both by increasing the total number of beds available, along with all of the things that I just referenced a little while ago. As it relates to what is the date we will hit that, I believe we sufficiently covered that question yesterday. At such time that we have new data or new modeling to share, you will be, you along with everyone else watching, will be the very first people to know.
Right. Well, I was just asking about the hospitalization rate currently, which I'm still not clear exactly what that is. But I did. I'll leave that alone because I think this is going to be the last follow-up I get. The number of new cases seems to be lower than we might expect that it would right now. I mean, the past few days, they could have gone up much higher based on the doubling rate earlier. But do we think the curve is flattening, or are there so many tests coming in batches that we really have no idea?
Well, I wouldn't say that we don't have any idea, but it is contingent on the number of tests. So we still are not at full capacity. We could certainly do more testing, and that would help us determine if we have more individuals out in the community that are positive, and we know that we do. We've consistently stated that those individuals that might have symptoms consistent with COVID-19, and that represents about 81% of the population that have mild to moderate symptoms, would stay at home. That leaves the remaining 19% of individuals that have more complicated symptoms, which would require them to be hospitalized and or admitted to the ICU. So it really is based on testing, and we are trying to increase our local capacity. You may have heard on the news that San Diego is conducting more tests than any other jurisdiction in the state, but it still is not enough. So we are trying to increase our capacity for testing each week. And that's going to determine if the data, as we continue to get new data, we will use that information to help really identify when our curve is flattening, and so that we can report that information to the public. Thank you.
So you don't think it's flattening yet?
Well, yes. Given the fact that we have new cases every day, no, sir. I don't think that we're flattening yet. We would have to see a peak and then a decline, or a steady or baseline of maintaining numbers of cases. So we are still in the incline phase.
Okay, let's go to the next question.
NBC 7, please state your name and question.
Hi there, this is Priya from NBC 7. The 12 deaths that you reported today, can you just put that into context? Are all these deaths, did they happen in the last 24 hours, or are we just hearing about them because they were reported over the last few days and, you know, it's just being reported today to you guys?
Okay, Dr. Wooten will answer that question.
Your latter comment is more accurate. Most of these deaths have been reported since yesterday, obviously, but they have occurred in the past several days. So it takes time to also confirm the deaths and complete the death certificate. So again, as Dr. McDonald stated yesterday, deaths lag behind the actual positive cases. And if I can kind of go through the process, an individual has onset of symptoms, then they are seen and tested. The test date is what we use to report kind of a daily report of cases. And then the deaths lag behind because those are not immediately reported to us, but once we get the death certificate, we reconcile the death certificate with the actual reports that come in. So deaths always lag behind. We see that every year with influenza as well.
Okay, let's go to the last call-in question.
iNews Source, please state your name and question.
Hi, Mary Plummer. Thank you. Are any prescription drugs such as hydroxychloroquine or others currently being used to treat COVID-19 in the county? And if so, can you please explain and specify which hospitals are using them and how it's going? I know New York has started using drugs like these in some cases and trying to get a sense of whether that's being considered or implemented yet here.
Dr. Wooten's going to answer that question.
And Dr. McDonald may have comments, but we are not recommending this medication, which is a medication typically used to treat malaria. There is limited research to support its evidence for its use in treating COVID-19. So locally, we are not recommending it.
And are hospitals allowed to use it if they think it's appropriate?
Well, let me step up and make a couple of comments. Number one, this particular drug is not FDA indicated for this use. You know, the specific use of medications with individual patients are certainly individual decisions that are made by clinicians. I can tell you that there are some medications that are being used in some hospitals specifically under specific protocols that allow the use of those medications. Remdesivir is a good example. It's an antiviral that has been used in some patients in some cases here in San Diego. But I know there's a lot of attention on drugs and the possibilities of certain drugs being used in patients. I can tell you that at this time there is no evidence of any specific drug that has specific efficacy or good use in these patients at this time. And there are a number of locations that are attempting to study whether these drugs in fact work. And specifically with hydroxychloroquine, you know, that is not recommended by us or by the FDA. Again, I think that it is concerning, frankly, that there's so much discussion about drugs that are maybe considered experimental, that are being asked about in such a detailed way, frankly. There's a lot of things to learn. There are probably good studies going on as we speak in various hospitals across the world. But again, I would caution anyone to be specifically describing any of these drugs as being specifically useful at this time. Drug therapy is something that will be very useful later on during our epidemic when it's based on evidence that it works.
Okay, Dr. McDonald, actually, I have another question for you.
Thank you.
From Cliff Albert with Kogo, what is the status of the Eclipse cruise ship?
Well, I think you can look out your window and see that it's still in the port. Again, we meet regularly with the port, the Coast Guard, CBP, the CDC quarantine station here locally, and the cruise ship task force to talk about the health of the ship's crew. To talk about movements of the ship, I think those are best directed to the port. To talk about the health of the crew, I would direct those kinds of questions to the cruise line or to the CDC. I think it's worth noting that all ships who are coming from international waters are in the jurisdiction and under the health status purview of the CDC quarantine station, the vessel sanitation program, and specifically the cruise ship task force. So I would ask that detailed questions about that go to those organizations.
And Dr. McDonald, I have a question from David from Channel 8. Can you explain how your recovery number reported on your chart today relates to the hospitalization number and the ICU number?
Well, the ICU number and hospitalization numbers are cumulative on that report. So when we get new reports of a status of a patient that changes and they were not hospitalized and became hospitalized, or were in fact hospitalized and then went to the ICU, we will update it on the cumulative numbers. Those are based again on reports that come to us and health records that we see, often on a delayed basis when the test was first reported, indicating somebody had COVID-19. The recovered number is, in fact, an estimate based, as the supervisor said, on the length of time between the positive test and knowing that somebody has not passed away from the infection. That is the standard that's being used in almost all of the websites that you see that report recovered numbers. We in public health don't follow that as a specific metric because it doesn't really help us in terms of public health response. It is a useful number to know, I think, for the public, which I think the estimate is very useful for, but again, we don't have the ability to spend a lot of investigator time to follow up on that. Our investigators are actually investigating active reports of new test results, and we are spending our time and effort on that. At a later time, perhaps after the number of case reports to us goes down, we will be able to look much more carefully and give you actual recovered numbers. But for now, the estimate will do.
Thank you, Dr. McDonald.
This next question deals with homeless testing, and I'm going to ask Supervisor Fletcher to respond to that question.
Yes, this is Will Huntsberry again from the Voice of San Diego. You all have told us a lot about your efforts to help homeless citizens in San Diego. Can you please tell us how many homeless citizens you have tested, and also talk about the extent to which COVID-19 may be moving through that community?
Well, we don't track, as we're now pushing close to 20,000 tests, we don't track the tests by occupation or by status of where they live. That's simply not how the data comes in. We do know that we did early efforts and actions many weeks ago to embed public health nurses in each of the homeless shelters, or at least 9 of them, to daily look and assess for symptoms and immediately get those individuals out of that environment, get them into a public health room where then they were ordered a test. We also know that we had those same efforts around homeless outreach teams, and all of those efforts certainly continue with the convention center. And so we're doing everything we can to identify early any unsheltered individual who may have symptoms and to make sure we get them into treating, but we don't track the total number of tests by that breakdown. We have confirmed, because for a while we hadn't had any positives who were unsheltered, and then when we did, we reported that. But we also at that time stated that we are not breaking out the total number of positives based on someone's status, their housing status. So the efforts we're doing continue, whether it be the efforts at the convention center, efforts with the homeless outreach team, efforts with the shelters, efforts with the public health motel rooms where individuals can go, and efforts with the regional task force on homeless rooms. And we will certainly continue that because we are acutely aware of the danger to folks who are in congregate care settings, to the danger to folks who have underlying health conditions, to the danger to folks whose kind of real-time health age may be different than their biological age, as you see in many of our unsheltered communities. And so we've put a significant effort around trying to protect those populations, but we simply don't track the number of testing in that way.
Thank you, Supervisor Fletcher.
What's the next text question?
The next text question, I believe Dr. Wooten is going to answer about some clarification on treatment. The question is from Carlo at Channel 8, was do they have any knowledge of anyone using hydroxychloroquine, not if it's not recommended? Wait, no, that's not clear. Not if it's recommended. I would like clarification because a family tells me their father was treated with it before dying on April 1st.
Well, first, let me express condolences to the family of the individual who passed away. Again, I think that when someone is got a very serious illness and is near death, frankly, physicians will try anything that might work. And in that specific incidence, I can see that perhaps a judgment might have been made that that the benefit might exist, so they might try it. I think that is a very, very specific situation, and in general, the discussion around hydroxychloroquine talks more about as a preventive or something up front with mild disease, and I would strongly discourage that, and I believe that all national authorities, including the FDA, also discourages that. But it goes back to judgment when there are some very significant health issues going on, and that may well have been done. I have no specifics on that.
Thank you, Dr. McDonald. And I have a question from Paul Sisson of the San Diego Union Tribune. How many new COVID investigations is the Public Health Department starting each day on average?
I don't have the exact number on me at this time. I can tell you that the number of investigations that are started is usually larger than the number of cases that are reported, because again, we look into each case, and then we also look into a lot of reports of cases that turn out to be not a case. So I would say that it's at least the number that has been reported and more, but I'll try to get back to you with a specific number at a later time.
That completes our texted questions. We do have one more call-in question.
Please state your name, your outlet, and your question.
Hi, this is Andrew Dyer from the Union Tribune. My question is about the COVID-19 numbers on military bases. Last week, the Pentagon stopped releasing data of how many cases are on local bases, but said that that data was being provided to the county of San Diego. Why isn't the county telling the community how many cases are on our local bases? And is there any law? Is it illegal for you to tell us how many? And if not, why won't you say?
Okay, Dr. McDonald will answer that.
I think this has been addressed before, but let me say that individual case reports come to us on something called a confidential morbidity report. It is by California law a confidential document that allows us to get personal information and allows us as the health department to investigate and get medical records. And these are all protected records. And so in the course of investigating these individual cases, we are sometimes able to give the public aggregated information, as we have on, say, ages of patients and racial breakdowns and locations of where they live in the community. But to specify by occupation, for example, specifically those who are military, we do not track that. And again, it's not that we are not being transparent. We are being transparent. The numbers that of cases of residents of San Diego are being reported to you on a regular basis. And I would ask you to go back to the military to talk to them about their policies on releasing general information.
Right, but these are the only places in the county where people are regularly still commuting to and from work, because these are places that have, these are necessary jobs, right? So if there are significant outbreaks on military installations or on ships, as we know there were before the Pentagon stopped telling us, isn't it the county's job to inform the public?
Well, actually, your first statement isn't correct in the sense that there are essential workers all over the county who are going back and forth to work, including a lot of county workers. And all of our law enforcement and healthcare workers and all the categories identified by the governor are, in fact, essential workers. And I think it's obvious that our military are essential workers for national defense. So I think that your first premise is not correct. And then, again, I think you should be directing these questions to the jurisdiction that has authority over these individuals. The county jurisdiction actually does not extend onto military bases. So when you ask about policies and procedures that the military is using, you should direct it to them. And actually, I do have a update for the question that Paul Sisson gave. In fact, we mentioned that the number of investigations would be higher than the number of cases reported. So the number of cases reported to date are 1,454, but the number of investigations is 1,718. The number of cases that were investigations that were initiated yesterday was 82.
Okay, that completes our calls and text questions for today. But before we leave, I wanted to take an opportunity to highlight some good news of organizations and people in our community who are stepping up to help others. Today, I wanted to highlight some local companies that are helping healthcare workers on the front lines in local hospitals. Suja Juice, a cold-pressed juice manufacturer, has delivered cases of its fruit and veggie drinks to Sharp Memorial, to Sharp Green, to the UCS San Diego Medical Center in Hillcrest and in La Jolla. Blenders, a Pacific Beach sunglass company, is converting its manufacturing operations to make safety goggles needed as protective gear for healthcare workers. Blenders is donating 10,000 safety goggles across San Diego and Los Angeles, including to Sharp Healthcare, Scripps Health, and UCLA Medical Center. I applaud these companies, and obviously I know there's a lot of other companies here in San Diego that are stepping up to take on new challenges and maybe manufacturing different things than they normally do. We thank and commend every one of those, even though maybe we haven't had a chance to acknowledge them here on these media briefings. With that, we will see you tomorrow at 2:30 for an update. And again, we remind people to live well, to stay well, and to stay well, stay at home. Thank you.